Although there's only 2 slides that I'm going to cover the homeostatic imbalances of the reproductive system, there's a whole lot of information I'm going to give you on this. Some of this information is just because you have a human body and you need to be able to know about it and take care of it. Some of this stuff will be test information. For instance, I'm going to give you a lot of stats. I'm going to give you facts and figures. I certainly don't want you to memorize how many people each year are diagnosed with testicular cancer or endometriosis or some of the sexually transmitted diseases. I do want you to know what the most prevalent are. I want you to know some of the major signs and symptoms and how these develop, and I want you to know what some of the treatments are, some of the stuff that should be common sense to us. Again, don't go into great detail on these. For instance, I don't want you knowing the particular bacteria that causes gonorrhea, or again, what the major treatments for, or the different types of chemotherapeutic treatments and such for different types of cancer. But again, you do need to know the basic information on all of these. But the bigger part of it, again, is I want you to be informed as a human. All right, so we'll begin with some disorders in the male, and we'll start with testicular cancer, and that's the most common form of cancer in the male between the ages of 20 and 35. So more than about 95% of testicular cancers are going to start from those spermatogenic cells that are in the seminiferous tubules. An early sign of testicular cancer is to find a lump or a mass in the testis. Sometimes you also have a feeling of the testes being very heavy or just having a dull ache in the lower abdomen, but usually it's not painful. It's more of an ache or a heaviness that is experienced. So to increase the chance of being able to detect testicular cancer in a very early stage where it would be much more curable or treatable, is that males should do just like females do. We're supposed to perform a regular breast exam each month. Well, males should be also performing regular self-examinations of the testes. So this should be done by starting in the teen years and done once a month, just like a breast exam in the female. So it's helpful to take a warm bath or a shower, and that, of course, is going to help to loosen and relax the skin of the scrotum and make this not an uncomfortable process. So each testis, though, should be examined. So you should grasp the testis firmly between your fingers and your thumb and gently roll it back and forth, and you're feeling for lumps or swellings or any hardness or anything that feels different than it did before. And if you do this on a regular basis, you learn what feels normal, and then you can easily detect what is not normal, and then, of course, consult your physician as soon as possible once something has been, once you do feel something that's out of the ordinary. Prostate disorders develop when the prostate begins to grow, as we mentioned, especially in males as they age. So this growth can, of course, affect the urethra. Any infection or enlargement or tumor that develops can obstruct the flow of urine. So acute and chronic infections of the prostate are very common in post-pubescent males, or those that are past puberty, and also usually can accompany some inflammation of the urethra as well. So some of the symptoms, if you think about inflammation, what do you have? Fever, chills. But when you're looking at the urinary bladder and the urethra, of course, you can have frequent urination or difficulty in urination or incomplete emptying of the bladder. Can also be very painful or burn during urination. Lower back pain, joint and muscle pain, and of course any time that there's blood in the urine or a painful ejaculation, that should tell you that there's something wrong, right? However, sometimes with these prostate disorders, there are no symptoms, but fortunately antibiotics can pretty easily treat any of these inflammatory disorders if they are bacterial in their cause. Acute prostatitis is when the prostate becomes swollen and tender, but when it becomes a chronic condition, it is usually going to affect more of the men of middle age and later years. So when examined, the prostate usually feels, or the prostate's going to feel enlarged and very soft and tender rather than being its normal firm and not tender to the touch. But sometimes as well, when the inflammatory response has occurred, the prostate will feel very irregular in its shape as well. Prostate cancer is the leading cause of death in men in the United States, even more so than lung cancer now. Each year there's over 200,000 men in the United States that are diagnosed and nearly 40,000 deaths from prostate cancer. So if you remember, we talked about PSA, or prostate-specific antigen, that's produced only by the prostate, is going to increase as the prostate enlarges, and this can indicate that there's an infection or a benign enlargement, or, worst case, the prostate cancer. So a blood test can pretty easily measure the levels of PSA, and in males over 40, in addition to a blood test for PSA counts, they should have an annual exam of the prostate gland with a digital rectal examination, where a physician is going to palpate through the rectum. So the fingers are inserted into the rectum, and then you feel or palpate the prostate gland, feeling for those disorders such as enlargement or irregular shape. And of course then it's pretty obvious if it is painful as well, because the person being examined will be in pain if the pressure, of course, does cause pain. So most physicians are going to recommend an annual PSA test for males that are over 40 years of age. Treatment for prostate cancer involves surgery or cryo or freezing therapy, radiation, hormone therapy, or chemotherapy, depending on how advanced the cancer may be. Many of these cancers, though, do grow very, very slowly, and some urologists simply recommend watchful waiting, because so many men over the age of 50 will develop this, so that the watchful waiting is watch while you're waiting, because this probably will occur. Also in men, we want to talk a little bit about erectile dysfunction, what we used to call impotence, and it's the consistent inability of an adult male to not be able to ejaculate or attain and maintain an erection long enough for sexual intercourse. So many of the cases of impotence are simply because there's not enough nitric oxide. Remember, nitric oxide was what caused the dilation of the erectile tissues and the arterioles that supply the blood to the penis. So if you don't have sufficient nitric oxide, then of course erection is very difficult to attain or maintain. The drug Viagra enhances that smooth muscle relaxation and by the nitric oxide, so that it helps the nitric oxide to work more effectively. Other cases of erectile dysfunction can cause some disease, or can be caused by some diseases such as diabetes, syphilis, vascular disturbances, testosterone deficiency, drugs and alcohol, antidepressants, antihypertensive drugs that lower the blood pressure, but also physiological factors such as anxiety or depression, or even fear of fertilizing an egg, so fear of pregnancy, right? Or fear of sexually transmitted diseases, or anything that can cause emotional distress can cause erectile dysfunction. Some of the female reproductive disorders that we want to talk about are premenstrual syndrome, what we commonly call PMS, and it's a cyclical disorder of severe physical and emotional distress that occurs post-ovulatory, so after ovulation, but before menstruation appears. So the signs are really variable from one woman to another, but they can include swelling or edema and weight gain, breast swelling and tenderness, abdominal swelling, backache, joint pain, constipation, acne breakouts, irritability, tiredness. I just want to sleep. I'm depressed. I'm irritable. I've got mood swings, headaches. I'm uncoordinated, and I'm craving all kinds of sweet and salty food. Yeah, sounds familiar to a lot of us, right? So the cause of this is really unknown, but for some women, they've found that getting regular exercise and avoiding caffeine, alcohol, and salty foods, and also eating a diet that's high in complex carbs and lean proteins can provide some relief during this time. Premenstrual dysphoric disorder is a more severe type of PMS, so it has the same types of signs and symptoms, but they don't go away after menstruation occurs. So the clinical research has found that for some women, just suppressing the reproductive cycle by a drug that interferes with gonadotropin-releasing hormone can decrease these symptoms dramatically. Also, taking SSRIs, selective serotonin reuptake inhibitors, has shown some relief as well in many women with the dysphoric disorder. All right, so endometriosis is when you have a growth of endometrial tissue that's outside the uterus. So remember, the tissue, of course, is normally inside the uterus and that inner lining of the uterus, but it can enter the pelvic cavity because, remember, the uterus is attached to the fallopian tubes, and the fallopian tubes are open just above the ovaries. So if you have retrograde flow, rather than when the endometrial tissue breaks loose and menses would normally occur, rather than it flowing out of the vagina, some of that tissue backflows into the fallopian tubes, and then of course it's out into the abdomen, where it can start to grow either on the outside of the uterus or on the colon or in any of the organs in the abdomen, or in the pelvic cavity or in any of the wall areas, so the abdominal wall as well. So endometrial tissue, as you know already, is going to be highly responsive to the reproductive hormones each month, whether it's inside or outside of the uterus. So with each reproductive cycle, the tissue starts to grow, and then it breaks down and bleeds. So when this occurs outside of the uterus, it can cause inflammation and pain and scarring and even infertility. So the symptoms for this include premenstrual pain or unusually very, very severe menstrual pain each month during the menses. All right, so something that's near and dear to my heart is breast cancer. I wish I had a lot of time to talk to you about this because this is something that has affected my family greatly. And I've lost my mother and her sister both to breast cancer, and my first cousin had breast cancer twice in her early 30s. So I do a lot of work for breast cancer advocacy and fundraising and walks for breast cancer. So I encourage you, if this is something that has touched your life, to try to do something good from it as well by getting involved in some of the organizations and some of the events and some of the things to help other people that may be suffering from this. So with that said, let me talk to you a little bit about this in the context of our course. So 1 in 8 women in the United States faces breast cancer over their lifetime. After lung cancer, it's the second leading cause of death for women in the United States. It does occur in males, but it's much more rare. However, in males, it's much more likely to become advanced before it is diagnosed because males, unlike females, don't think breast cancer when a lump develops in their chest. It's estimated that about 5% of the 180,000 cases diagnosed each year right here in the United States arise from those in younger women, those that arise in younger women are going to be from inherited genetic mutations. So researchers have identified 2 genes that are associated with an increased incidence of developing breast cancer, and that's BRCA1 and BRCA2. BRCA1 also creates a higher risk for developing ovarian cancer. Because breast cancer is usually not painful until it's very far advanced, any lump or any invagination or any swelling or anything that is abnormal in the breast should immediately be checked by a physician. Early detection, whether it's by self-examination or mammogram, is the best way to increase your survival for breast cancer. My mother went 7 years in her 50s, or from her late 40s to her early 50s, and did not have a mammogram. And her breast cancer was very far advanced when it was diagnosed. So the importance of early detection is something I cannot stress to you enough. So some of the risk factors for developing breast cancer, of course, are going to be inheriting those mutated genes, the BRCA1 and 2, having a family history of breast cancer, especially in your first-degree relatives, your mother, your sister, your daughter. Never having a child or having your first child after age 35. This is related to the estrogen-related breast cancers. Previous cancer in one breast. exposure to ionizing radiation like we get when we have x-rays, excessive alcohol intake, and cigarette smoking all increase your risk for developing breast cancer. The American Cancer Society recommends that these things be done to help either prevent breast cancer or for early detection. So, 1, live a healthy lifestyle. Avoid things that you know can cause cancer. Diet and exercise. Eat healthy foods. Stay in relatively good shape. If you're over 20 years old, you should every single month do a breast examination on yourself. When you do a breast examination, you should go all the way out into the axillary area, all the way up to the clavicle, across to the other breast, and several fingers of distance below the breast. You want to feel every bit of that breast tissue, feeling for anything that doesn't feel normal. And then you want to very gently squeeze the nipple and look for any abnormal discharge. So anybody over the age of 20 needs to be doing this. Males, you need to as well. You can develop breast cancer. The original Shaft, Richard Roundtree, developed breast cancer. Peter Criss, the drummer for Kiss, the original drummer, developed breast cancer. But they were very proactive and they both survived. So I tell you this, men, check yourself. Women, tell the men that you love because they're not going to check. All right, so a physician should do a breast exam about every 3 years on women between the ages of 20 and 40, and every year in women over the age of 40. A mammogram should be taken over the age of 35 to 39, and that is going to be used as your baseline mammogram that can be used later for a comparison to make sure that there are no abnormal changes in the breast tissue. Even women that have no symptoms should have a mammogram every year after the age of 40. But in women that have a history of breast cancer or a strong family history of breast cancer or an increased risk because of some of the other factors, should talk to your physician and figure out how often you need to have a mammogram. That's the most important thing. Take charge of your own health. Treatment for breast cancer can involve hormone therapy, chemotherapy, radiation, lumpectomy, where the lump is removed, or a modified or radical mastectomy, or a combination of these approaches. So a radical mastectomy involves removing all of the breast tissue along with the underlying pectoral muscles and some of the axillary lymph nodes, because it's the lymphatic system, especially in the axillary area, where breast cancer is most likely to first metastasize. Radiation and chemotherapy will typically follow this surgery just to make sure that any of the metastasized cells that may be in the particular area or in the circulating in the bloodstream or anywhere else in the body have been killed by that chemotherapy. So again, take care of yourself, check your breast, and oh, by the way, check your breast. And then next month, don't forget to check your breast again. All right, so even though ovarian cancer is the 6th most common cancer in females, it's the leading cause of all gynecological malignancy deaths, with the exclusion of breast cancer. So everything else that's related to the female reproductive system over breast cancer, ovarian cancer is the next leading killer of women. It's very difficult to detect because, of course, the ovaries are in the abdominopelvic cavity. So most of the time it has metastasized before it's detected. Risk factors include age, so over the age of 50. Caucasian women are at higher risk than other ethnicities. Family history of ovarian cancer. Over 40 years of active ovulation, not having children or first pregnancy after the age of 30, high fat, low fiber, vitamin deficient diet, and prolonged exposure to asbestos or talc all increase your risk of developing ovarian cancer. Early ovarian cancer has no symptoms or only very, very mild ones such as abdominal discomfort, heartburn, nausea, loss of appetite, bloating, and even flatulence. So it's pretty easy to see how one wouldn't automatically think, oh goodness, I have ovarian cancer, until it has progressed quite far. Later stages, signs and symptoms include an enlarged abdomen, a lot of abdominal and pelvic pain, very persistent gastrointestinal disturbances, urinary complications, menstrual irregularities, and very heavy and painful menstrual bleeding. Cervical cancer is when a carcinoma of the cervix develops in that lower part of the uterus, and it affects about 12,000 females each year in the United States and kills about 4,000. Usually begins as a precancerous condition that can be detected by a pap smear. So almost all cervical cancers, though, are caused by the human papillomavirus, HPV. Other types of HPV can cause genital warts that we'll talk about in a few minutes, but it's estimated that about 20 million Americans are currently affected with HPV. But sometimes, rather than just causing warts, the immune system can't fight it off, and HPV can cause cancer that takes years to develop. So HPV is transmitted through vaginal, anal, and oral sex, and the infected partner may not even know that they have it because they don't have any signs or symptoms. The signs and symptoms include abnormal vaginal bleeding, heavier periods than normal, bleeding after intercourse, heavier or longer than normal periods, continuous vaginal discharge that may even have a little bit of blood mixed in with that. But there are several ways to decrease the risk of HPV infection, and these include avoiding risky sexual practices, unprotected sex, sex at an early age, multiple partners, or partners who engage in high-risk activities. If you have a weakened immune system, you're much more likely to develop these HPV-related disorders and susceptible to HPV or getting the HPV if you are engaging in risky behavior. But there are 2 vaccinations that are available to males and females that can help to prevent you from contracting the HPV, from contracting the virus, the HPV virus. And of course, remember, that's what causes most types of cervical cancer. Those vaccinations are Gardasil and Cervix. So certainly that is something that if you have young children, or if you have not received those vaccinations, it's something that you might want to consider strongly, knowing what the risk factors are if you do contact the HPV or contract the HPV virus. A yeast infection is caused by a fungus that grows on the mucous membranes of the gastrointestinal and the genital urinary tracts. And the most common form of yeast infection is called vaginitis, and it's an inflammation of the vagina. And it's characterized by very severe itching and a thick, yellow, cheesy, smelly, yeasty, odory discharge, and very often accompanied by pain as well. About 75% of females will experience at least one yeast infection at some point during their life. Sometimes it's a result of the fungus just being able to overgrow because of taking antibiotics for another condition. So normally the bacteria that inhabit the vaginal canal keep the yeast from overgrowing. But if you're taking antibiotics that kill some of those bacteria, then the yeast infection can, of course, develop during that time period. All right, so let's talk just a little bit now about sexually transmitted diseases. Again, I want to remind you I'm going to give you quite a bit of information here. Make sure you get the basics on these sexually transmitted diseases. So, of course, these are diseases that are spread by sexual contact. In most developed countries of the world, the incidence of STDs has decreased, but not the United States. The incidence of sexually transmitted diseases has risen to almost epidemic proportions, affecting over 65 million people in the United States. That's scary. So let's talk about some of these. Chlamydia is transmitted by bacteria, and it is the most prevalent sexually transmitted disease in the United States. In most cases, the initial infection is asymptomatic, so it's difficult to recognize clinically. In males, urethritis or an inflammation of the urethra is usually what is going to happen, and that leads to a clear discharge or burning during urination, sometimes painful and frequent urination. Without treatment, the epididymis may also become inflamed, and this can lead to sterility. About 70% of females with chlamydia, there are no symptoms. But chlamydia is the leading cause of pelvic inflammatory disease, so it's later on in the infection that the female tends to start noticing symptoms of this. And by this time, the uterine tubes can also become inflamed, and that's going to increase the risk of ectopic pregnancy and infertility due to formation of scar tissue in the tubes. Trichomoniasis is a common STD and considered to be the most curable. Not that that's good, but at least we can cure it. So it's caused by a protozoan, which is a normal inhabitant of the vagina in females and the urethra in males. Most infected people don't have any signs or symptoms. When the symptoms are present, they include itching and burning, sores on the genitalia, discomfort during urination, and a foul-smelling discharge in females. Males typically experience itching or irritation in the penis, burning after urination or ejaculation, and sometimes some discharge as well. But trichomoniasis can also increase the risk of infection with other sexually transmitted diseases. Gonorrhea is a bacterial infection that we sometimes commonly call the clap. In the United States, there's usually about 1 to 2 million new cases of gonorrhea each year, and usually also among the ages in individuals that are somewhere between the ages of 15 and 29. Discharge from infected mucous membranes are the primary source of transmitting this bacteria during sexual contact or during the passage of a newborn through the vaginal canal of an infected mother. So the infection site can be in the mouth or the throat after oral genital contact, or in the vagina and penis after genital intercourse, or in the male after rectogenital contact. Males usually experience urethritis and have a lot of pus drainage with very painful urination. The prostate and the epididymis can also become infected and, of course, become inflamed as well. In females, the infection usually occurs in the vagina, often with a discharge of a foul-smelling pus again, but both infected males and females can harbor the disease without any of the symptoms until it's progressed to a very advanced stage. About 5 to 10% of males and 50% of females have no symptoms. Scary stuff there, huh? In females, the infection and the inflammation can proceed from the vagina into the uterus, the uterine tubes, and the pelvic cavity. It's estimated that somewhere between 50 to 80,000 women in the U.S. are infertile because of gonorrhea, and they develop that, or that many more develop it each year as a result of the scar tissue that develops and closes off the uterine tubes. And if the bacteria in the vaginal canal are transmitted to the eyes of the newborn, that can result in blindness. So this is, if you've ever wondered why they put the drops of silver nitrate into the eyes of a newborn, it's because the silver nitrate will kill the bacteria that causes the gonorrhea, and of course, therefore, the inflammatory response doesn't lead to the blindness of the newborn. So syphilis is also caused by a bacteria, and because it's sexually transmitted, it's transmitted through sexual contact or exchange of blood, or in some cases across the placenta to the fetus. So the disease of syphilis progresses through several different stages. The first stage is the primary stage, and the first sign is usually a painless open sore called a chancre. The chancre heals somewhere between 1 and 5 weeks and usually reoccurs as a rash, which may be accompanied by a fever and achy joints and muscles, and that's when it has entered the secondary stage, so it's systemic and it's spread throughout most of the body. When the signs of organ degeneration start, the disease is said to be in its tertiary stage. If it involves the nervous system, the tertiary stage is then called neurosyphilis, and this is what typically drives people mad or causes them to become very emotionally unstable and develop symptoms that look very much like dementia. during this stage. So the motor areas of the brain become damaged, and this can lead to the inability to control urination or bowel movements. Eventually, people that have neurosyphilis especially are going to become bedridden and even unable to feed themselves. In addition to all of this, the damage to the cerebral cortex can produce memory losses and personality changes that can lead from irritability to hallucinations to complete loss of memory. Genital herpes is an incurable sexually transmitted disease, as are all of the ones that we've talked about that are viral. Okay, so genital herpes is caused by the herpes simplex virus 2 that causes genital infections and produces painful blisters on the penis or on the vulva or inside the vagina of the female. The blisters disappear and reappear in most patients, but the virus doesn't. The virus stays in the body. There's also a related virus called herpes type 1, and that is what causes cold sores on the mouths and lips. So in individuals that are affected with this typically have breakouts several times a year. Genital warts can appear as a single or multiple bumps in the genital area, and they're caused by several types of HPV, the human papillomavirus. So the lesions can be flat or raised, small or large, shaped like a cauliflower, and have multiple finger-like projections. So you never know what they're going to look like, right? Just abnormal growth. Nearly 1 million people in the United States develop genital warts each year, and they can be transmitted sexually and may appear weeks to months after sexual contact, even if the person that gave it to you had no signs or symptoms. In most cases, though, the immune system is able to defend against HPV, and the infected cells revert back to normal within a couple of years. But if the immune system is not effective in doing that, then the lesions appear. There is no cure for genital warts, but there are some topical gels that are useful in treatments. But again, remember, this is caused by HPV, and the vaccinations, especially the Gardasil, can protect against HPV, including genital warts.